Hey, what's going on, guys? Jerem Dastrup here with Dental Intelligence. I'm so glad that you've joined us and you've clicked on this link to watch this video. I am super excited, as always, when I have these guests come on, but especially with Katrina Sanders. You guys have heard this story through multiple videos. Great friend, amazing colleague, awesome dental professional, and super excited about her topic today, talking about reducing broken appointments. Now, I know we've all been in that situation where we're looking at each other when an appointment doesn't come or it doesn't show. We've got holes in the schedule and it's almost too late to figure out how we fill that. And we know that that's not a patient that's being seen. That's not revenue that's being generated. That's not a treatment plan being exercised. And so let's turn it over to Katrina Sanders to find out all these nuggets that she's going to give us today on how we can reduce broken appointments. It's yours.
Oh, thank you so much, Jerem. And it's always a pleasure to be on and working with you. You know how much I respect and adore all the things that you guys are doing at Dental Intel. So thank you so much for having me. And I'm so grateful to be here, developing some of the programmatic content for you around how to optimize your profitability formula around reducing broken appointments. And, you know, I hate to say it, but we are in these kind of uncharted waters where broken appointments have always kind of been an Achilles heel, a thorn in doctors' side, right? Like they hate having hygienists sitting around doing nothing. They hate, open holes in their schedule. These are things that we struggle to prepare for. They throw a stick in the spokes in our day. And it makes it really difficult for us to reach our bottom line and optimize the work that we're doing. And now here we are amidst some of the challenges of a global pandemic and a health crisis. And so along with some of the layers that we're starting to see, our patients are experiencing different avenues, different lifestyle changes or life component changes that are impacting their desire/willingness to be able to present into the dental practice. So these are things like our patients have experienced furlough and job loss. Our patients have had to file for a stimulus or unemployment. Our patients have walked up and down the aisles of the grocery store where they've seen a lack of abundance or a lack of necessary ingredients, which quite frankly in the United States is not something that we're used to seeing, and it can be very concerning. However, in tandem with that, I think we also need to acknowledge that while we are in a financial challenge, that this is different than the financial crisis that we experienced in 2008, 2009. And that is, this financial crisis is not due to a complete challenge associated with our market, but rather the fact that there is a health disparity. And so first and foremost, before all these financial challenges, our patients are experiencing a fear of infection, a fear that they may experience the infection, that their family, their loved ones may experience infection. And so there is a desire for health, wellness, and vitality. And there is a desire for alleviating the health risks or risk factors that could elevate the propensity of them experiencing this disease process. So our patients have a multifaceted motivator when it comes to their decision making right now. Before this pandemic happened, how many of us can openly admit that maybe we were competing with that brand new Louis Vuitton bag or the brand new Tesla or the trip to Disneyland that we wanted to take our family on? And now we have what I consider to be a more educated community. We have a community who understands infection control, albeit not to the extent that we in dentistry do. We all see those silly people out in public with their own loose interpretation of infection control, but the reality they're beginning to understand that infection control is something that they need to be mindful of. There is a renewed value in personal health and wellness. maybe before the pandemic, we were a bit more cavalier about our immune system and how we approached that. But now we're restructuring or re-triaging what our needs versus our wants are. Our patients are spending whatever money they do have on hand sanitizer, bleach, toilet paper, versus some of these ancillary and possibly unnecessary needs. Our patients are watching on the news as certain populations, age groups, or comorbidity risk entities have an elevated risk for experiencing COVID. And they're watching as those are individuals who are experiencing more advanced signs, stages, or symptoms of this disease process. And they're beginning to understand that although this is an airborne acute infection, that there could be systemic challenges, that individuals could experience things like stroke from microclots or clogs in their blood vessels, that they could experience kidney challenges, that some individuals are on respirators or losing their life to an acute infection. And I don't mean to downplay or diminish that at all, but I want to be very clear that now we have a society that is educated. And if we remove the word COVID and we put in the word oral disease, hypertension, heart disease, we begin to understand that now we have an opportunity to color the picture for our patients about why it's been important for us to institute appropriate hygiene appointments and stabilizing oral health for our patients. And so in order to do this, we're going to be looking at some core strategies that I believe we can institute within the dental practice to help them better understand the why behind what it is that we do. And that's going to begin with providing patient educational opportunities. And I've got some really great tools that I'm so excited to unpack for you in this program around that. The second is training and calibrating your administrative team members, because oftentimes when a broken appointment occurs, it occurs first through those team members. So how can we train them and help them better understand the ways to create a better conversation with our patient? We also need to know when is it that we need to escalate the conversation from a front office team member to a clinician. And stay tuned as we talk about that. Finally, creating the opportunities to continually reinforce patient commitment to overall health. So buckle up, Jerem, let's get started. I want to begin by talking about the importance behind delivering patient educational opportunities first. And in order to do that, we need to take a look at where our patient is receiving their education right now. This was released in July of 2020 from the CDC. From the top down, these are the sources of information that our patients are receiving about COVID. So the top source, the number one source, is television, followed by the internet, social media, the grocery store. Do you see us, Jerem? There we are. Healthcare provider is underneath all of those layers. And then finally, the newspaper and the radio. So could we theoretically say then that when a patient has concerns, whether it's financial or whether it's, I don't think I'm safe coming into a dental practice, more often than not, the majority of those individuals are receiving that information from a newscaster, from someone else on television, somewhere on an internet article written by somebody, or gosh, maybe on social media, which isn't that a program for another day, about how we should be maybe not using social media to the fullest of our extent as a true source of scientific fact. And so my question to the dental community becomes, don't you want to be the one to educate your patient? And how is it that you do that? There are so many different ways to do that. First and foremost, your office website. Go onto your website after this program. Look around. If you're a prospective patient or even an existing patient, does your website have any information about these are the new steps we're taking to protect you? These are the things that we're doing to screen patients. These are the things that we're doing as employees to make sure that we aren't contracting anything to you. Does your website say anything about that? Or does your website just have the blanketed statement that every website does, which is, due to COVID, yes, we are still open, but please forgive us for any delay in response. Think about what your website says when it comes to educating and communicating with your patient. In addition, social media accounts. What does your social media account share with the patient about their safety? This is an opportunity to really get involved and show videos of your hygiene team suiting up, putting on all of their PPE, taking temperatures on patients, the patient screening paperwork, showing them the things that you're doing to protect them. This could also be things like showing the steps in your sterilization area to make sure that the equipment is safe to be working on patients. We could also be instituting patient newsletters, print or email versions, available for our patients to understand and receive that education. And finally, one of the things that I absolutely love is a pre-appointment video. So what I've started to institute with our practice is recording a video of myself to my patient that's sent out 24 to 48 hours before their appointment. And it looks a little something like this. Hi, my name is Katrina. I will be your dental hygienist with AZ Perio. I'm so excited to see you for your appointment tomorrow. I wanted to take some time to introduce myself, show you what I look like without a mask on, because when you see me tomorrow, I'm going to be completely covered from head to toe in personal protective equipment, which is one of the many things that we're doing to protect you and other patients from our current health crisis. I'll go into things like educating my patient on why I'm so grateful that they are dedicated to their oral health, which, stay tuned, we're going to talk about later on in this segment. These videos get sent out to the patients, and I must say, Jerem, the response that I get is amazing. Patients will come into their appointment and they'll say, thank you so much. First of all, I loved that video. It was so good to be able to see you without your mask on. And I was concerned about coming in, but after viewing that video, I feel so much better. So thank you for walking me through the things that you're doing to protect me. One of the other things, of course, that we can look at is a patient-centered communication strategy. So this is an example of something that I had put out on social media for our perio practice. This is a video of both me and Dr. Holly McKnight, who's a diplomat with our AZ Perio practice. And the two of us are going back and forth, having a conversation about the current World Health Organization recommendation to delay dental procedures. And it's essentially the two of us saying, these are the things that we've learned about dentistry and its involvement in potentially helping to control the exacerbation of this current global pandemic. Stay tuned again as we talk about that a little bit more. But these are social media entities that we have put out for our patients. And this video is also embedded into patient communication when we are confirming our patients. There's a little link to this video. There are opportunities when we're emailing patients and trying to get them back on schedule, that these videos are utilized to help our patients better understand the why. Let's move on to step 2, train and calibrate our administrative team members. So first and foremost, it's important for us to make sure that we have a step-by-step conversation to educate patients on infection control standards. I'll tell you, when this pandemic first hit, Jerem, I would go to one grocery store and it was, you have to wait 6 feet back and you can't put your groceries on the belt until we've wiped it down from the person ahead of time, and then other grocery stores had a different philosophy. And so we're all just kind of building the plane as it's flying. But part of the fear is patients don't know what are the expectations and what should I expect when I come into the practice. So this is an opportunity for front office team members to have that conversation up front and preparing patients for that. And if a patient tries to break their appointment, to stop and take a step back and remember that part of the concern for the patient is likely a health challenge. We need to be educating our patients as well briefly on the understandings around oral and systemic diseases. The fact that we're bringing patients in for appointments, not because we're a business and we need to keep our business up and running. I mean, let's be real. That's part of the reason why we have patients coming into our office right now, but also because of the things we're understanding about the links between oral disease and this current health crisis. We also need to consider the verbiage that we're using, the ways that we're unpacking this information for our patients. So I love using the terminology for your protection and for the protection of others. letting our patients know we are instituting screening, temperatures. Our staff members have to complete screenings every day. They have to institute, temperature measurements. They are wearing full personal protective equipment for your protection and the protection of others. We have reduced aerosol generating procedures in our practice. Everybody's required to wear a mask at all times. We have, HEPA filtration systems that create high level air changes per hour. We've had our HVAC system evaluated for air changes per hour. Utilizing terminology like that helps our patients understand that they are indeed protected. The other terminology that I love, and I actually am stealing this from the local coffee shop just across the way here. This coffee shop put something up on their door, and I'm like, I love this, and I'm stealing it. They said, some of the procedures that we're doing or our infection control strategies have always and will continue to be X, Y, and Z. Patients are expecting dentistry to look and feel different. And I agree, they absolutely are. But at the same time, they do need to know that there are some strategies that we have always been doing and will continue to do. Things like making sure that our equipment is sterilized. Things like making sure that we're utilizing an intermediate level disinfectant, that we are wiping down all surfaces that are semi-critical or non-critical, that we test our water, that we test and shock our dental unit water lines, that we are shocking our suction lines, that we are testing our pumps for efficacy. Our patients need to know that these are steps that we have always and will continue to do, so that they know we have always been providing this high level of care for them. Step 3, know when to escalate to a clinician. And this is where I encourage front office team members to know and back office team members to acknowledge that a broken appointment is not simply something that should remain at the front office. If this is a patient who is fearful of their safety in the dental practice, if this is a patient who's questioning our infection control standards, if this is a patient who's pushing off their dental treatment because they don't see the value in it, or they're looking at their risk to benefit ratio and they believe that it's not worth it to risk, we need to involve a clinician. And there are several ways that we can do that. First of all, from a front office standpoint, if we have an at-risk patient, a patient who maybe answered yes to any one of our screening questions, for example, this may behoove us to involve the clinician who's going to be treating that patient. So that clinician can make a decision about if that is a safe patient to be seen in the practice. When we've been doing these health screenings, unfortunately, what I've seen with a lot of my clients, Jerem, is that that screening actually remains at the front desk. And the back office clinicians don't weigh in on if that's a safe patient to be seen or not. The second and third layers would be if you have a medically compromised patient, and patients will say, at this time, I have uncontrolled diabetes and I don't feel safe coming in and exposing myself. That is a conversation that needs to go to the clinician. That patient needs to receive a phone call. Hi, Susan, it's Katrina, your hygienist. Thank you so much for sharing that concern. Gosh, I am just as concerned about your diabetes as you are. So let's have a conversation about some of the things that we can do to protect you. And that needs to go back to the clinician. In addition, patients with advanced infection control inquiries, there are those patients that want to know more. And those are things that we do need to lean on a back office team member to answer. That cannot be the responsibility of the front office team to go into some of the advanced protocols around the things that we've done from an infection control standpoint to support our patients. Finally, and this is the most important thing if you take nothing else away from this program, is reinforcing your patient commitment to overall health. This is an all-team approach, and it's a wraparound approach. The other day, I was in my practice, and I heard one of our doctors, Bruce Hauser, he went in for an exam with our patient, and, introduced himself to the pleasantries that all doctors do, did the exam. And then at the end of the exam, as he was taking his gloves off and performing hand hygiene, he said to the patient, Thank you so much for prioritizing your oral health. We continue to learn information about how the infection in your mouth can make your body sick, and you being here is a dedication to your health. So thank you. And I just thought, what a beautiful thing to say to a patient, to build value in the work that we do. So it's important for us to understand and identify the fact that we have a role in educating, and that starts with the front office team. It moves through to the hygiene team, doctor when he or she comes in for an exam, and even on checkout, that the entire team needs to be involved in that. Listen, we understand that there are risk factors that absolutely are moving in tandem. This information on the left shows risk factors for advanced signs, stages, or symptoms of COVID. This comes to us from research of September. And then on the right, this is from our Academy of Periodontology, and this institutes or unpacks the risk factors of perio. If I could just be so bold as to say that there are some gosh darn similarities there. And so it's important for us, especially when we look at the risk of our patient population, it's important for us to understand that we need to be threading through this communication strategy. Again, think about if you wanted to institute a recording for your patient, a pre-appointment recording, or something that you put on social media. These are pieces, Jerem, that I put into my pre-recorded video. So my patients get to hear my raspy voice talk about, I'm concerned about this and I'm concerned about that. And I'm so excited that you're coming in because we are beginning to understand that there could be a link between oral hygiene and severity of this current infection. So we did shut down for a while because we didn't know, but as we're continuing to learn, we are beginning to understand that now more than ever, it's imperative for us to, I would say, roll up our sleeves, but we need to keep our sleeves down for PPE purposes. But we do need to be wearing, all of our personal protective equipment and letting our patients know that that is the first line, but certainly not the last line of defense in protecting our patients. That the work that we do, the intricate work we do in addressing inflammation, addressing infection, aids our patient in rendering their body healthier, more resilient, and stable. In fact, we're now beginning to understand, and again, you and I both know I could geek out on this content all day. I'm kind of a big microbiome nerd, Jerem. I don't know if you know that about me, but I love talking about bacteria. I think microorganisms are like amazing. And the world of what these viruses are doing is truly incredible when you think about it. They are far more sophisticated than we are. They've been on this planet a lot longer than we have. And it's really amazing to see. So I could geek out on this all day, but I'll spare our viewers. I will say this, however. We're beginning to identify that individuals that have inflammation, especially in the oral cavity, present with high levels of inflammatory cytokine markers, particularly this inflammatory cytokine marker we're looking at called IL-6 or interleukin 6. When an individual has high levels of interleukin 6, which they'll have if they have inflammation in their body, they have a 22 times higher risk of experiencing respiratory conditions. We also know that oral biofilm is easily aspirated into the lungs, which can elevate the risk of experiencing advanced respiratory infections from a completely different angle. And finally, now we're beginning to identify that it's highly likely there's a plausibility that poor oral hygiene could lead to prolonged viral shedding in patients that have COVID. So as we're continuing to understand this information, the broken appointment isn't simply an inconvenience in our day. That broken appointment is a patient that is walking around without the delicate services that we should be providing to them. And our opportunity to create a 360 approach in helping our patients understand the value of the work that we do, that approach begins now. That approach begins with looking at the various steps that we need to take to better support our patients in success and optimized wellness. Again, Jerem, I'm so grateful. Thank you so much for letting me be a part of this, for letting me unpack this content, and of course, for letting me geek out just a little bit on microbiome. If anybody has any questions, if there's anything that I can ever do to support you, please find me. You can reach me on my website, www.katrinasanders.com. You can slide into my DMs, find me on Facebook. You can also email me, katrina@katrinasanders.com. Jerome, this has just been a blast. Thank you so much for having me.
Oh, I'm so glad that you joined us. I look forward to the many more that we'll be doing.
Absolutely.
I've got to just pull a couple things apart here that I love. First,
Yeah.
I love the quote that you said, or the statement you said, building the plane as it's flying. Meaning that, I mean, you take the COVID, circumstance, you take 2020 circumstance. There's uncharted territory, exactly what you just said, that we are just learning as we're going. But the last thing to do is stay paralyzed.
Yes.
You've got patients that need to be seen. There are people that are desperate to get in and get that treatment done. And so I love building the plane as you're flying. So good. Take action, do something.
Yes.
Some of the questions I've got for you. Let's dive a little bit into this idea of communicating to your patient base the safety that is there.
Yeah.
Acknowledging that. Let's go through that a little bit. Dive a little deeper into that.
Yeah. So, I mean, there are so many different ways that we can do that. But I would say from an initial standpoint, patients respond well to videos, photos, anything that's really wordy like that, I have not seen to be as successful. And we've done videos on, when the patient, as a confirmation email or a confirmation text message, it'll say, check here for the safety protocols that we've instituted in our practice. And it's a beautifully edited video of, one of our practice liaisons, Gina. And hi, my name is Gina from AZ Perio. We're going to walk through the things that you can expect when you, present into her office. And it's got the like, like really fun music, and she basically walks through as a patient. When you walk in, you're going to see plexiglass. It's not that we don't want to hug you. It's that, there's a plexiglass in the way to protect you. You're going to step in here. We're going to be taking your temperature. You'll have some paperwork to fill out. Know that our office, you're going to be socially distanced. We do have less chairs in the waiting room. We don't invite, additional people back in the treatment rooms like we used to. This is what your provider is going to look like, and it's a funny picture of one of us in our PPE. These are the strategies that your hygienist is taking in the back to protect you. When you leave the operatory, this is what your hygienist is doing. And it's a, fast motion video of the hygienist, doing, different steps or walking through that process. We even have little videos on, let's take a tour of the sterilization area. This is what our equipment goes through. Because as you and I both know, patients, when they saw that World Health Organization recommendation, they read that as it's not safe to go to the dentist. And the reality is they're safer going to the dentist than they are eating the silverware that went through the dishwasher at the restaurant up the street. We have more layers and more steps in play, and we've had those things in play. So we do have instructional videos on that. We have instructional videos on, I'm so excited that you're coming in for your dental appointment, because these are the things that we're learning from the American Academy of Periodontology, the American Dental Association, the ADHA. These are the things that we're understanding about research, and we're continuing to read that research for you. We institute things like, this is a high volume evacuation system. This may look new for you, but know that we're using this to protect you. And we always end every sentence with, to protect you, so that our patients know, they understand. We're using pre-procedural mouth rinses, so you'll be expected to use this mouthwash before you sit down in our chairs to protect you. And so those are ways that we've instituted those things, even showing videos of what our staff looks like coming in, through the back staff entrance, the fact that we have to put shoe coverings on, that we don't wear our scrubs outside of the office, that we are wearing this PPE, that we take screening very seriously, that we're taking temperatures, what our back room looks like. We are only allowing 2 people in the back room for lunch. So showing that social distance spacing, etc. Those are things that we've instituted. And, and this is kind of an interesting concept too. We also screen for hand hygiene. So we audit our hand hygiene, and we let our patients know that we have high levels of hand hygiene audits, meaning that every time a provider walks in or out of that operatory, you will hear a little click of the hand sanitizing station. We perform full scrub-ins, and these are things that you should expect from us every single time you come in. Small little things like that really make a world of difference. And then making sure that those things are pushed, not just on social media, but put a tab on your website, put a landing page on your website so patients know what you're doing to protect them.
Oh my goodness. So good. So good. And I love that the priority, and you said this dozens of times through this presentation, that this is for you.
Yeah.
This is for you. These are the measures we're taking for you as a patient, so you feel more comfortable, you feel more confident, you feel safe, you feel secure, so the treatment can be done. I absolutely love it. Well done. Well done.
Good. It's,
So awesome.
That's important for our patients to understand that. And gosh, all of us that are wearing PPE and sweating through it like I do, and, can't take their N95 off to take a sip of water, and, can't run to the restroom throughout the day. Like, we are uncomfortable, but we're doing this, you guys, we're doing this to protect our patients and to better our community. That's our why. That's our number one responsibility as essential frontline workers. And that's what we get to do. Our patients need to know that they matter, and that they are a part of, what it is that we do. They're a part of our family. They're an extension of what we do. And that now more than ever, we are critically evaluating the steps we need to take to best protect them.
Cool. So very good. Well, you guys, there you have it. Reducing broken points with proper communication, setting expectations, creating a safe environment. The question I'm going to ask all of our viewers is, have you really assessed the effective channels that you have in the communication to your patients? One little post is not going to do it. They're not all going to see it. If you send one email, or is your email list updated? Is your text platform working? Do you need a text platform? How do your patients know that when they arrive to their appointment, they're going to be safe, they're going to be secure, they're going to be protected, and that you've taken all those measures? So I love it, Katrina. Thank you so very much. And I know we've got a couple more videos that are going to be coming out with Katrina, so stay tuned. Make sure you check it out. Make sure you watch them. She's always lacing it with good content and good nuggets to help you as a dental professional increase the quality of care that you are giving, and increasing that experience that the patient is having there with you. So any last words before we close it down?
No, I just thank you so much for this. And for everybody out there, thank you for all of the amazing work that you're doing to support our community and wellness. You are the ones that are putting on the cape every day and fighting that good fight. And, we're better together. We're better building that plane together so that we can fly together. Awesome. Be safe and be well.
I love it. I love it. So sounds good, guys. Thank you, Katrina, so much for everything that you do. And once again, to all of our viewers, thank you for joining us today, and stay tuned for more content with Katrina Sanders. We'll see you guys. Have a good one.